medication overuse headache has been a concept that's been around since around the 1980s, probably even earlier. But it became very popular in the 1980s as a target. And the concept, for those of you who don't know about it, is that when patients with particularly migraine overdo acute meds, their headaches get worse. They get more headaches, they get worse, they're unresponsive to preventive medications, for example. And therefore, the obvious treatment is let's take away the acute medications. Problem is, as soon as we do that, headaches get worse, people aren't happy, they're not comfortable, and so all sorts of strategies have come up about what to do about the difficulty in getting people to stop these offending acute medications. And unfortunately, the data really don't help us that much. There are some data for sure, and there's some good studies that have been done and attempted. But the simple answer is we don't exactly know the best way to detoxify or treat medication overuse headache. And I have a theory about one of the main reasons why that is. And my theory is that there's not just one kind of medication overuse headache. There are many, depending on the medication that's causing the medication overuse headache and the person. There are people who probably can take plenty of acute medications and not fall into this vicious cycle. Other people, they take a minor analgesic more than a couple of days a week, and they're locked into this medication overuse headache. So I think we'll probably learn more about it when we learn or we'll learn more about the best treatment for MOH when we learn about the causes of MOH, which we really don't fully understand yet. I think we have enough evidence and also experience, just clinical experience, to say that when people seem to be in medication overuse headache, they do need not just detoxification, they need a good preventive medication. And we're kind of lucky here because the new groups of preventive medications, which are the CGRP monoclonal antibodies and the small molecule CGRP antagonists, they seem to be useful even when the acute medications are not discontinued or when acute medications can be switched to different acute medications. That may not be true. That seems not to be true with other preventive meds, so we're kind of lucky. This is a good time to be treating patients with medication overuse headache, and you know, we have more and more options. I think as the years go by, and I'm talking about maybe the 5-year period, we're going to have even better options.